Okay, well, that was a great segue because I really wanted to get an update on weight loss medications. Last time we talked a little bit about weight loss medications. It's something that you deal with and you use with your patients, which I think is wonderful. I think I could be wrong about this, but I'm pretty sure you were the first person to come on this show back in 2022 and tell us about GLP-1 agonist drugs that were, I mean, they've been around and been around, especially for like type 2 diabetes, but we're just starting to kind of get a little bit more attention. And now they've gotten a lot of attention. You've had a lot more experience working with them at this point. Um, can you give us like a bit of an update on how things are going? What things you see could be good, could be bad. And maybe we should start out by even explaining what these things are and what they do.
Sure. So GLP-1 agonist medications, so GLP stands for glucagon-like peptide. Basically, these medications are peptides that agonize in different areas of the body and work to help suppress appetite. So they work in your brain to decrease overall cravings. They can help with cravings for carbs and sugar, overall appetite suppression, the lower hunger levels. They work in the gut to slow down gastric emptying, which can help you feel fuller quicker. And then they work in the pancreas directly to improve insulin sensitivity. There's also GIP agonists that agonize GLP-1 and GIP receptors. So GIP stands for gastric inhibitory peptide. Those dual agonist receptors are like Mounjaro, Zepbound, and those are also known as tirzepatide. So we have like Wegovy, Ozempic, semaglutide, and that's GLP-1 agonists. And then you have the GLP-1 and GIP agonists, the dual agonists, which are newer. And so these medications are once weekly injectables that you do yourself. They're like subcutaneous. And so because they work in all those different parts of the body, they're showing like amazing results when it comes to weight loss. But that does definitely has like a caveat. So when it comes to my like medical opinion as a weight loss doctor, what is the best medication for weight loss on the market? Definitely injectable weight loss drugs are the best. If you compare them to like stimulant drugs like phentermine that have been out for 30 plus years, these injectables are like changing the game. People are losing like 10, 15, 20, 25% of their body weight. But they're not all perfect. Like they come with a slew of side effects. There's like risks to anything. They're extremely expensive. And so about a quarter to a third of our patient panel actually takes the medications. And if I have a patient who comes to see me as their weight loss doctor and their first thing is like, the first thing out of their mouth is like, "Hi, my name is Charles. I need Wegovy." It's like, this is not going to be a good therapeutic relationship. Like, the priority needs to be like, "Hi, my name is Charles. I want to better my health. I want to drop 50 pounds. I want to reverse my diabetes." Because the best part of my job is de-prescribing drugs. Like, I love when people lose 75 pounds and no longer need medicine to lower their blood pressure. I love when people drop 40 pounds and don't need a statin anymore because their cholesterol is amazing and their triglycerides are lower. I love when people come to me with diabetes and now they no longer need insulin because we were able to taper them off since they lost so much weight. So that's the type of like client and like doctor patient relationship that I really love. And I'm just like, I actually say this during my first weight loss seminar with patients is like, I am not a vending machine. If you're just like, "Hey, nice to meet you, give me Zepbound," it's like, that's not going to work with me. Like these medications are specifically a tool for a certain type of patient. And if a lot of things are not in place for them to work, then they're like not going to be helpful for you. So if you're the type of person who's going to take Wegovy and eat pizza, bagels, and ice cream all day, like it's not going to work out because you're going to be sick all of the time. You're going to have severe acid reflux. You're going to have bloating, GI distress. You're going to lose muscle mass, not like actual body fat. And so that's what I mean when I say they're not all perfect. They're not this like miracle drug. They're amazing and they can do great things, but like with a caveat of like you have to put in the work yourself.
This is probably a way over obvious question. I'm just curious for that person who comes to you for the vending machine, they just want the pill, and you say, "Hey, this isn't going to be a good relationship." Is it terribly difficult for them to find a doctor who would be that?
Oh my God, they could literally leave and on their phone walking out of the building, they can find
Okay.
like a nurse practitioner in like Alabama that'll just call it in for them. So it's
Okay.
not the people that I work with, like I don't know. I do have that happen and sometimes I do suggest that they see someone else. if that's how they're treating it. It depends on their attitude about it, because maybe they're saying that and they're just not understanding that it's a dietary change as well, you know, like that they have to put in this extra work. They just might not know any better. And
Yeah.
so I'm like, I'm willing to like put in the work and teaching them. And that's why the first time meeting me is it's like a course seminar that's 90 to 120 minutes, which we were joking about sitting through classes earlier, but it's like, I do that because there's so much to teach when it comes to metabolic health and insulin resistance. And if you're not taking a dietary approach first and foremost, then like nothing that we do is going to work. Like no other tool that I can reach for is going to help if the diet's not on point.
Gotcha. Okay, that's really well explained. And check me on this as well. I believe that the dosages for type 2 diabetes, those medications have different names. It's the same drug, but it's just a much smaller dose, and it works. You mentioned all the places that the drug works at. I believe that the type 2 diabetes drug dosage works more in the brain, and that the weight loss drug transfers more of the effectiveness in the gut, where it's actually slowing things down because you're ramping up the dosage over time to be the highest kind of dose that somebody can tolerate. Do I have that correct?
So that's not quite accurate. So basically, it's Ozempic and Wegovy are both semaglutide. Wegovy is just one little tick higher than Ozempic in terms of dosing. So Ozempic's the max dose is 2.0 milligrams. Wegovy goes up to 2.4. So it is a little bit higher for the weight loss, but it's actually the same molecule. They're both semaglutide. And then tirzepatide is the one from Eli Lilly, and that medication, also once per week, is marketed as Zepbound for weight loss and Mounjaro for type 2 diabetes. And they actually have the exact same dosing. It's like 2.5, 5, 7.5, 10, 12.5, and 15. And those medications are a bit stronger than Wegovy and Ozempic. Like there's more weight loss in clinical trials. With the caveat of in clinical trials, they don't do low carb, they do calorie counting. So the trials are
Okay,
not exactly
gotcha.
how I would set them forth.
Yeah, yeah. Okay. Thank you for explaining that. And let's start with kind of the good about this. I didn't know that you could lose that much percentage of somebody's body weight, like 10, 15, 20, 25%. Is that something you see also, not just at trials, but that's something that you notice?
So in our patients, like in my clinic who are on GLP-1 or the dual agonist with the GLP and GIP, we see an average of 20 to 30% weight loss because of how strict I am about diet.
Gotcha.
So that number is just slightly better than the patients who I see who are doing it without medication. The patients that I see without medication are still losing an average of about 25 pounds every 6 months and almost 50 pounds in a year. It's just that the medication helps to, like in patients who have issues with food addiction or binge eating, it can like help with the food noise. So it kind of like unlocks the ability for those patients to lose weight a little better because they can adhere to the diet more. So I
Gotcha.
really am utilizing these medications as like a way to adhere to a diet rather than like this like miracle drug that you see on Facebook. I can't believe like the stories that you see on social media where people are like, I eat whatever I want and I'm down 75 pounds on Ozempic. Like it makes me crazy because I know in clinical practice, I have plenty of people who take the drug and eat like they've always eaten and they lose 4 pounds. Like nobody's coming to me to lose 4 pounds, and probably the 4 pounds is muscle.
Wow. Yeah, I hear those commercials all the time as well, and I just want to throw my phone across the room or whatever. Oh
Yeah.
man. Okay. And then you also hear that these are lifetime drugs. Once you start, you're on them forever. Once you stop, you gain a bunch of weight, so you have to continue. Have you had success with people that have wanted to eventually get off of these, as far as like tapering them down and getting them off of them successfully?
Yeah. So what's interesting is in all of the clinical studies and trials on these injectables, they do like basic calorie counting, right? And when you do basic calorie counting, people are like, well, I can still eat pizza, but only one slice. And I can still eat sandwiches, but only half. And I'm still going to have chips, but only half the bag, right? So everyone's just doing the same diet they've always done, which is the standard American diet of 6 to 11 servings of grains all day long, but they eat smaller portions. As soon as you get rid of the medication, people gain all but 6% of their body fat back because they never fix their diet. So we take this like super important hormonal like biological approach to weight loss where it's like you have insulin resistance, you have to prioritize protein, fat, and fiber whether you're on a drug for weight loss or not. And then if you ever want to, remove the medication, if you're on Zepbound for a year and get to your weight loss goal, you're actually able to taper off that medication if you remain low carb, high protein with a good exercise regimen, possibly an intermittent fasting plan. It's like absolutely possible. But I will say it's probably 50-50 where like half are able to do it no problem and half struggle because as soon as you get rid of the medication, the food noise comes back and they're like, this is how I felt before and I did not like thinking about food all of the time. So
Gotcha.
it's like a risk that you're, taking. Just like when you sign up for these medications, you're signing up for all the potential side effects, especially if it's something that's just like being called in, right? Like through the internet, like you meet a nurse practitioner for 5 minutes and they're calling in Ozempic, like, or, semaglutide, just like the generic version that's compounded. You're signing up for all of the risks, all of the benefits, all of the potential side effects without really understanding them wholeheartedly. And so that's one risk is like, what if you stop the medication and you don't like the way that you feel off of it? Although
Got
right
it.
now it looks like in longer term studies, like we have a 4-year Wegovy trial that's out there that shows clearly people can take it without increased risk of any kind of like coronary artery event or cancer risk for a 4+ year period, which is really good that we have that data now because now I can share that with patients and say, look, we have 4+ year data that says nobody's getting any kind of crazy cancers or anything from these medications. They're getting muscle loss. There's cases of pancreatitis, but like at least we know long term there's no increased risk of cancer. It actually looks like there's a decreased risk of colon cancer and possibly other types of insulin mediated cancers. So
Interesting.
the jury's still out on like long-term use. Like we don't know about Wegovy 10+ years out because we don't have like a study showing that.